Good, good day, everyone. Ga-echo ko.
Wala.
Wala ra.
Wala
Okay.
ra.
So now I'm going
Klaro
to...
ra kayo, Inday. Klaro ra kayo.
Yes, Doc. So now I'm going to begin. Again, good day, everyone. I am Sheena May Marie A. Benzuela, and I will be discussing about the drugs acting on the reproductive system together with Green Essential and Reina May Tagalog. So now I am going to introduce to you the reproductive system. Okay, so the reproductive system make up the structures that promote conception and development of a fetus, as well as the endocrine glands that create the hormones necessary for the regulation and maintenance of the structures and facilitate reproduction. Okay, so now let's focus first with the female reproductive system, which consists the uterus, the ovary, and etc. So these are the functions of each reproductive organs. So first, we have the ovaries, which store the ova or eggs. So the eggs contain half of the genetic material needed to produce a whole cell. Each ovum is contained in a storage site called a follicle that acts as an endocrine gland producing the hormones estrogen and progesterone, which will be discussed further later. Okay, so very near to each ovary is a fallopian tube. So this fallopian tube is a muscular tube with a ciliated lining that is constantly moving and transports sperm towards the egg. This movement propels the ovum release into the abdomen, down the fallopian tube, and into the uterus, which is the site for the developing embryo or fetus, and the fetus. Okay, we also have the uterus, which nourishes the developing fetus prior to birth. So the
Kadyot lang
uterus,
kadyot lang if I may correct you, kay medyo murag dili magunais paminawon. I think I told you before that when as a general rule, when you pronounce e that precedes letter T, you should pronounce it as E, not an E. Again, if the E precedes letter T, so it should be pronounced as E, not E. Like meter, fetus. Na, dili makamay kong meter. So kay ako dati kang gi-correct, I'm sorry pero I have to correct you kay pananglitan ba og mo adto niya mo sa magtrabaho na mo niya inyong pronunciation wala na corrected basin niya mo katong nakahibalo pronunciation mo katawa ba mo nang at this stage this is learning man gihapon ni siya, please do it the correct way kanang pag-pronounce sa fetus. Dili na siya fetus, sa fetus na siya. Okay, you may continue lang ga. Sige.
yes, Doc, understood, Doc. So again, the uterus nourishes the developing fetus prior to birth. So the uterus, as a muscular organ, can develop a blood inner lining called the endometrium. So this endometrium allows for implementation of the fertilized egg and supports the development of the placenta, which provides nourishment for the developing fetus and acts as an endocrine gland, producing the hormones needed to maintain the active metabolic state of the pregnancy. The muscular walls of the uterus are also important for expelling the developed fetus through the vagina at delivery. Okay, so now let's proceed with the the external genitalia of the female reproductive system. So this consists the clitoris, which is the pleasure center of the vulva, then the labia, which includes the labia minora and the labia majora, that covers and protects the urinary openings, the vaginal openings, and the clitoris from external trauma. And then the vagina, which has three main functions. First, it provides a passageway for blood and mucosal tissue from the uterus during menstruation. Second, it receives the penis during sexual intercourse. And third, it holds the sperm until they pass into the uterus. Okay, so now let's proceed with the hormones associated with the female reproductive system. So these are the estrogen and the progesterone. So the primary goal of these hormones is to prepare the body for pregnancy and to maintain the pregnancy until delivery. So the estrogen includes the estradiol, which function or purpose is to mature and then maintain the reproductive system. The estrone is a weak estrogen responsible for female sexual development and function, and then the estriol, which promotes the uterus growth and gradually prepares a woman's body for giving birth. So what happens here is that the estrogens enter the cells and binds to receptors in the cytoplasm in order to promote the messenger ribonucleic acid activity, which results in specific hormones for cell activity or structure. So many of these effects are first noticed at the menarche, which is the onset of the menstrual cycle. Okay, so here are the sum of the effects of the estrogen. So first, we have the growth of the genitalia in preparation for the childbirth, the growth of the breast tissue in preparation for pregnancy and lactation, the stimulation of protein building, which is important for the developing fetus, and the increased total blood cholesterol for energy for the mother as well as the developing fetus. We also have the alteration of the pelvic bone structure to a wider and flaring pelvis in order to promote easier delivery. Okay, next is the hormone progesterone. So progesterone is released into circulation after ovulation. It also helps to regulate the menstrual cycle and prepares the uterus for pregnancy. So some of its effects are the following. First, the decreased uterine motility in order to provide increased chance that implementation can occur. And then the development,
Implantation.
just now. So
Dili implementation. Implantation.
just look, implantation. Okay, so again, we have the decreased uterine motility to provide increased chance that the implantation can occur. And then the development of a secretory endometrium in order to provide glucose and a rich blood supply for the developing placenta and embryo. And the thickened cervical mucus to protect the developing embryo and keep out bacteria and other pathogens. And then the increased body temperature, which is a direct hypothalamic reaction to progesterone, which accelerates metabolism and enhances embryonic activity. So, those are only some of the functions of the progesterone. Now, I am going to explain the control mechanisms of the menstrual cycle. Okay. So here, the developing hypothalamus is sensitive to the androgens released by the adrenal glands and does not release the gonadotropin-releasing hormone or GnRH during childhood. Okay. However, as the hypothalamus matures, it loses its sensitivity to the androgens and starts to release GnRH, which is why menstrual period occurs only at puberty because it is the time when the hypothalamus is mature enough to lose its sensitivity to the androgens. Okay, so once the hypothalamus releases the GnRH then stimulates the anterior pituitary to release FH and LH. Okay, then the FSH and LH stimulates the follicles on the ovary's outer surface to grow and develop. These follicles is also known as the Graafian follicles that produces progesterone, which is retained in the follicle. It also produces estrogen, which is released into the circulation. And then when the circulating estrogen levels rises high enough, it stimulates a massive release of LH from the anterior pituitary, which is called the LH surge. Okay. Then this surge causes one of the growing follicles to burst, releasing the ovum and its stored hormones into the system. So the release of an ovum from the follicle is called ovulation. LH also causes the rest of the developing follicles to shrink in on themselves or involute and eventually disappear para isa na lang mapilin. So the ovum is released into the abdomen near the end of one of the fallopian tubes. And then as what I've said earlier, the constant movement of the cilia within the tube helps to propel the ovum into the fallopian tube and then into the uterus. So the ruptured follicle becomes a functioning endocrine gland called the corpus luteum. Okay, so this will continue to produce estrogen and progesterone for 10 to 14 days unless pregnancy occurs. So the human chorionic gonadotropin is produced after the ovum is fertilized and implanted in the uterine wall. This hormone encourages the corpus luteum to continue releasing estrogen and progesterone in the and until the placenta forms and becomes functional, which allows these hormones to be produced at a level that is sufficient enough to keep the pregnancy going. However, the corpus luteum involutes and produces a white scar called the corpus albicans if pregnancy does not occur. So the rising levels of the estrogen and progesterone produced by the corpus luteum operate as a negative feedback to the hypothalamus and pituitary. So these broken lines here represents the negative feedback, which halts the GnRH, FH, and LH synthesis and secretion. So the corpus luteum atrophies later in the cycle, and then the dropping estrogen and progesterone levels urge the brain to produce GnRH again, which repeats the cycle. So that's how the menstrual cycle works. Okay, so this slide
Okay,
also talks.
go back to that slide. Okay, in short, ang iyang gustong paibaluan is the usual route of your negative feedback mechanism with regards to the formation of your hormones FSH and LH. Now, what is very important in the statement nga iyahang gibasa is ang LH surge. Please take note, the anterior pituitary secretes your FSH and LH in surge. Ibalo ka sa surge, ibalo mo ana, kanabitan by spurts. Kalit bitag daghan. Mura shh, o kalit kayo de yung muhinay na pod. Now, this sudden surge of the release of this gonadotropic hormone is very, 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 very significant for the production, for the break of your follicles, releasing your ovum or ovulation. This is really very important in ovulation. Okay. So, kay kinahanglanon man di ay ang surge, ang sudden spurt of the release of the hormone in order for your ovum to be released. So, it would follow nga if you have a constant supply of this FSH and LH, you will not ovulate. Please remember that. It is the sudden surge that causes ovulation. If your gonadotropic hormone remains at a steady state, there will be no ovulation. This is very important in the process of contraception. You might ask a question if you are thinking enough. You might ask, your estrogen and progesterone is necessary for the production of your ovum and your and maturation. But why is it that the contraceptives that you give all contains your estrogen and progesterone at varying amounts? So, if you want to stop ovulation, why are you giving this estrogen and progesterone? In fact, you need this estrogen and progesterone for ovulation and maturation. Okay, so this is the answer. Because ovulation only happens if the release is in surge or by spurts or pinakalit og daghan og release. If the release will be constant, there will be no ovulation. That is the reason why your contraceptive pills contains your estrogen and progesterone. Even if it contains your hormones that causes the maturation and ovulation, still you will not get pregnant because you are providing your body with constant monotonous supply of your hormones, not in spurts. Okay, that is the reason. So again, you just follow the negative feedback mechanism and it follows. Please be sure to identify again the functions of your FSH for males, FSH function for females, the function of LH for males, and the function of LH for females. And that is very important in order for you to understand why we are using these drugs to treat your fertility problems. Okay, another thing, the number one, it has been theorized that the number one cause of your breast cancer is prolonged exposure to estrogen, which means if that is the problem, you can inhibit exposure to estrogen so that there will be less chances for you to develop breast cancer. Another reason is with prostatic cancer naman sa lalaki. The theory is that the prostatic cancer develops usually with prolonged exposure to high doses of your testosterone. No, we don't have a choice. Sa male, kaya we have a lot of testosterone. Females don't have a choice because they have a lot of estrogen. So, anara na, balance na. So again, your human chorionic gonadotropin is released after your ovum has been fertilized, which means your HCG-DI would determine the status of pregnancy. So if your HCG or human gonadotropin is only released after the fertilization of the ovum and implantation, therefore, your HCG is a good indicator of pregnancy. Okay? And this is the hormone that we test to determine whether you are pregnant or not. It is a very simple test. Just use your urine because this is excreted by your urine. You just use the urine, place it on that disc, then you will have a positive if duha ka buok linya na. Ang usa ka niya, it is not. It is a control line. Okay, so next slide.
Yes, Doc. Okay, so next is, okay, so this slide also talks about the menstrual cycle. So the meaning of menarche, I already said that. And then the effects of the estrogen during the menstrual cycle and the effects of progesterone during the menstrual cycle. You can take a look at that later. So during the menstrual cycle, as the vessels shear off, high levels of plasminogen in the uterus prevent the coagulation or the clotting of the lining. And then as the uterine lining sheds away, the prostaglandins in the uterus stimulate uterine contraction to clamp off vessels. So important note is that menstruation repeats approximately every 28 to 32 days. Okay, now let's proceed to pregnancy. Okay, so first, after the ovum is fertilized by a sperm, a new cell is formed which rapidly divides to form the embryo. And then, the embryo implants into the wall of the uterus, and the interface between the fetal cells and the uterus produces the placenta. So the placenta is a large vascular organ that serves as a massive endocrine gland and provides oxygen and nutrients to the growing baby. So to support the uterus and the growing fetus, the placenta maintains high levels of estrogen and progesterone. And then as the placenta ages, the levels of progesterone and estrogen also decreases. So eventually, the stimulation to increase uterine activity induced by oxytocin, which is a hypothalamic hormone stored in the posterior pituitary, overcomes the propensity to suppress uterine action. So in other words,
Ganyan lagi ko nakanotice. Unsa na siya anterior what?
anterior pituitary. Okay.
Continue.
Okay, so in other words, the tendency to block the uterine activity is overcome by the stimulation to increase the uterine activity, which is why there is a frequent voiding during pregnancy. Okay, so now at this point, the local prostaglandins stimulate the uterine contraction and the onset of the labor. So this contraction causes the thinning and dilation of the cervix and helps the baby to descend into the birth canal. So this prepares the baby for or the mother for delivery. So once the fetus and the placenta have been removed from the uterus. So once the baby have been delivered, the hormone levels drops toward the non-pregnant state. So this is the postpartum period. So since the hormones cause their effects by entering the cells rather than reacting with the receptor site on the cell membrane. Reversing their effects can take about 6 to 8 weeks. And then during this period, the body goes through a lot of changes because, of course, the body is no longer supporting a growing baby. So the activities during pregnancy has to stop, and uh, that's why homeostasis has to happen. Okay. Next is the menopausal period. So, as woman ages, the ovaries follicle become depleted, causing the ovaries to stop producing estrogen and progesterone, which causes menopause. So, menopause naturally happens after the age 45. So, the effects of menopause is associated with the loss of the effects of the hormones progesterone and estrogen. This includes the retention of the calcium in the bones and the lower serum lipid levels and maintenance of the secondary sex characteristics. So, as the estrogen leaves the blood vessels, many women experience hot flashes or vasospasm. Also, they also experience the drying of vaginal tissue that can lead to painful intercourse and more frequent urinary tract infections or UTI. Okay, so that ends my
Okay, please
discussion.
take note of the functions of your estrogen and progesterone. That is really very important. Again, your estrogen is necessary to keep your mood. That is one thing which has not been mentioned. Estrogen is necessary to keep your mood. Now, with decreasing estrogen, you will have hot flashes, you'll have alteration of mood, namiyo na ka nga, sa puto na nakayo siya, kay gaminopause naman good. I think you have heard such a statement. Sa puto na kaya na siya, kay tungod gaminopause naman good. And that is really correct because your estrogen supports mood balance. And all the other functions have been mentioned already. So please take note of that. And of course, another function of estrogen is for the anti-osteoporotic effect because it suppresses the osteoclastic effect of your PTH. Again, some of you still are confused with what is osteoclastic and osteoblastic. When you say osteoblastic, that is bone formation, whereas osteoclastic is bone destruction. And how will you know that that is bone formation? Because the young bone is known as osteoblast, and the mature bone cell is known as osteocyte. So it must be formation of bone, it must be osteoblastic because osteoblast is a young bone cell. Okay, go to the male reproductive now.
Okay, so the male reproductive system consists the following organs. So including the vas deferens, which stores, produce sperm, and carries the sperm from the testes to be ejaculated from the body. The prostate gland, which produces enzymes to stimulate sperm maturation as well as lubricating fluid. And then the penis, which includes two corpora cavernosa and a corpus spongiosum, which are structures that allow massively increased blood flow and erection. And the urethra, through which, so here's the urethra, through which urine and the sperm and the seminal fluid are delivered. We also have the urinary bladder. So what happens here is the walls relax and expands to store urine and contract and flatten to empty urine through the urethra. Okay, next is the seminal vesicle. So the seminal vesicles make fructose or a sugar-rich fluid that provides sperm with a source of energy and helps with the sperm's motility or the ability to move. The epididymis carries and stores sperms that are created in the testes. It's also its job to bring the sperm to maturity because the sperm that emerge from the testes are still immature and incapable of fertilization. So the testes, which is the major male reproductive system structure, are the two endocrine glands that continually produce sperm as well as the hormone testosterone. And then the scrotum, which holds and protects and helps to protect the testicles. Okay, now let's look deeper into the testes. So the testes move down the abdomen and into the scrotum outside the body during the fetal development. So there in the abdomen, they are protected from the body's heat in order to prevent injury to the sperm producing cells. So the testes has two distinct parts, the seminiferous tubules, which is the site where spermatozoa or the male gametes are produced. Then there are interstitial or Leydig cells, which is located in the connective tissue surrounding the sperm producing tubules of the testes, which is responsible for the production and secretion of the hormone testosterone.
Okay, so ang imong balik sa ang imong seminiferous tubules is the site of sperm production. The sperm will mature at the epididymis. Again, it is in the epididymis that the sperm cell matures, although it is made in the seminiferous tubules, whereas your testosterone or your androgen is manufactured or secreted by your interstitial cells of Leydig, or simply called your Leydig cells. Okay, so again, going back, tanaw tong previous picture nimo. Okay, so when you have ejaculation, it follows through from the epididymis to your vas deferens, then to meet with then enters your prostate and joins with your seminal vesicle, what you call the duct of your seminal vesicle. Again, ang imong vas deferens enters into the prostate, joins with the duct from the seminal vesicle, and empties into the ejaculatory duct, then to the urethra. Then the urethra is a common canal for both the sperm and the urine. Okay, which means that if you are to remove this prostate, kanang orange ang color is the prostate man. If you are to remove the prostate, then you will ejaculate. The ejaculate or the semen will go to the urinary bladder, not outside of your urethra. Okay? Only a trickle will go to the urethra. Hopefully, makadalag yapon na siyang sperm. But most of it will go to the urinary bladder because you are creating a space that was occupied previously by the prostate. Once you remove the prostate, in cases of prostatectomy or removal of the prostate, remove this, when you ejaculate, padulong sa inyong urinary bladder ang inyong semen, dili padulong sa urethra. That is called retrograde ejaculation. So, if you still want to impregnate ang mga lalaki, then do not do prostatectomy yet. You can do transurethral incision of the prostate only to relieve you of the obstruction sa prostate. Hiwa-hiwaan na siya, parang at least mugawas kung gawsan ka, mugawas gyapon sa imong urethra. And again, what is the function of FSH and what is the function of your LH with regards to the male? Sige, go next.
Okay, so now I'm going to discuss about the hormone testosterone. So the testosterone, like estrogen, enters the cell and binds with a cytoplasmic receptor site to influence mRNA activity, resulting in protein synthesis for cell structure and function. So these are some of its effects. So it is responsible for the growth of the male and sexual accessory organs. And then the thickening of the vocal cords, which produces a deep male voice. And then the hair growth of the face, on the face, body, arms, legs, and trunk. The increased protein anabolism and the decreased protein catabolism, which causes larger and more powerful muscle development. And then the increased bone growth in length and width, which ceases or ends when testosterone starts stimulating epiphyseal closure, and then the thickening of the cartilage and skin, leading to the male gate. Okay, so now I'm going to discuss about the control mechanisms of the male sexual hormone system. So just like in females, the hypothalamus in male children is sensitive to circulating levels of androgen. So the hypothalamus only releases the GnRH once or during puberty. Okay, so when the GnRH is released, the anterior pituitary stimulates the release of the FSH and LH, also known as the interstitial cell stimulating hormone or ICSH in males. Then after the stimulation, spermatogenesis occurs. So this is the process in which the FSH directly stimulates the seminiferous tubules to produce sperm. FSH also stimulates the sertoli levels in the seminiferous tubules to release estrogens, which generate the negative feedback to the anterior pituitary and hypothalamus. Okay, which results in a decrease in the GnRH, FSH, and LH production. The Sertoli
Okay,
cells.
in other words, mao na siya imuha nga functions FSH and LH sa male. Okay, go next.
Okay, next is the
Yeah.
LH or the interstitial cell stimulating hormone. Okay, so the LH stimulates the interstitial cells to produce the hormone testosterone. So the concentration of testosterone acts in a similar negative feedback system with the hypothalamus, which is shown here. And then when the concentration is high enough, the hypothalamus reduces GnRH release, which in turn decreases FSH and LH production. So basically, magtuyok-tuyok lang siya. So once the level of the hormones drop off, it stimulates again the release of the GnRH, and then the GnRH again stimulates the anterior pituitary to release the FSH, LH, and so on. Okay, so in women, we experience menopause. In men, they experience andropause, which is a condition characterized by a decline in the testosterone levels in men. This causes men to experience decrease in sexual drive. So this is when kanang the penis of men no longer erect. Okay, so next is the human sexual response. So humans can be sexually stimulated by a variety of stimuli, including the thoughts, sights, and touch. So there are 4 stages of this sexual response. First, we have the period of stimulation or the excitement that includes the minimal increase in sensitivity and the start of sympathetic nervous system stimulation. Then the plateau stage when the stimulation levels is off. So here, the glands at the end of the penis swells and the testes enlarge in the male. In the female, the outer vagina contracts and the clitoris retracts. So in the plateau stage, the breathing becomes more rapid and the muscles continue to tense. Then after that is the period or the stage of climax. So this results from massive sympathetic stimulation of the body. Here, there is a sudden forceful release of sexual tension called the orgasm. So this is also the shortest phase in the sexual response because it only lasts for a few seconds. Then after that is the period of recovery or resolution. So during resolution, the body slowly turns to its normal level of functioning and the swelled and erect body parts return to their previous size and color. So that ends the stages of the human sexual response.
Okay,
That's
in relation to that, your sexual response, this sexual response cycle na mention niya is only good for the male. Why did I say this is only good for the male? Because once the male has an excitement, then the plateau phase, there's only a very, very slight kanang time difference between your plateau and your orgasm or your climax. Gamay lang diferensya, gawsa na ka. Muna siya sa male. And once nagawsa na ka, resolution always follows. Or this is the period de tumescence or resolution. Muhumok yun ang imuotin once magawsan ka. Okay? Pero ang female is now it will take for the males it will take some time pa before another erection will take effect. Like nayuban paspas kayo 5 minutes motog na po, nayuban dugay-dugay na magkagulang ka magkadugay ang imong period of resolution. The older you are, that stage of resolution will become longer. In fact, when you get very old, sometimes once a year na lang ka mautgan. Under normal conditions, ha? Wala ilabot na nang naimugamit kag mga Viagra diagon sa. Under normal conditions, once a month, once every 2 months na lang mautgan na sila, na kanong magkagulang. And it is normal. But nowadays, of course, you can circumvent such a statement by taking medicines for erectile dysfunction, because the problem with erectile dysfunction is the persistence of your cyclic GMP. With your cyclic GMP, ang inyuha manggod is it will maintain the vasodilation effect of your CGMP. So if you increase or you maintain the amount of your cyclic GMP, you maintain the dilating effect. So, persistent ang mga erection. Whereas with the older generation, if you become older, ang imuha you cannot maintain the balance sa imuhang cyclic GMP. Dali ra siyang mawala. Because of course, it will be destroyed man. All the neurotransmitters, once it takes its effect, will be destroyed, man. And that follows with your cyclic GMP. So, in order for you to maintain erection, you must also maintain the amount of your CGMP so that dilation will take effect. So, prolong ang erection. That is why ang inyuhang medicines to treat or to solve the problem of erectile dysfunction are geared towards increasing or maintaining or preventing destruction of your cyclic GMP. Okay, this is with regards to your phosphodiesterase inhibitors. Now, again, ang difference na sa male o sa female is ang female is multi-orgasmic. Ang laki single ra kasagaran. Once nga gawsan ka, that's the end of it. Ang babae, no. Ang babae is multi-orgasmic, meaning once nga nagawsan ang babae, if you continuously stimulate the female, they will also continuously, again and again, do or experience a climax. Again, multi-orgasmic ang babae. So, if you want to satisfy your partner, paningkamot lang taon diha nga sigihan na siya og stimulate. Ikaw no humana ka, ani you can use all the other things. Okay, just make a wild imagination what you can use to simulate your partner. Kaya man naman, kausa naman ka. If only if foreplay na pero di na mo matter kaayo with regards to your climax. Kung magsige ra kag foreplay di no. Okay? Mukaging na lang imong dila diha og foreplay. Na, of course, you have to let your partner have a climax. But then again, your foreplay will help, pero until diha na gina siya. That's why it's called a foreplay. The function of your foreplay, by the way, foreplay is very important. Ha? The function of foreplay is for lubrication, para magbasa-basa ang babae. Without foreplay, diretso ra kag tirada din ha, it will not be a good sex. Reason is, it will be painful for both the male and the female. Painful, why? Kay wala pa siya gabasa. The foreplay will do that. That is the purpose of a foreplay, para mo dunay lubricant nga ma-release ang females. Without doing a foreplay, diretso lang kadi tirada, it will be painful for both partners. Sakit ng mala, dahil mo dahil tirahan. And then, if you go older, as was stated by the reporter, if you go older, siyempre magkamala ka, dryness. So how do you will become old? We don't have a choice unless you die early. Now, once you get older, please do not forget to advise your clients or yourself mismo if you get older to use lubricants. There are a lot of KY jellies in the market. You can buy tubes of KY jelly para dunay lubrication. Because dryness, I mean, having a dry sex or having sex with a dry vagina doesn't make a good performance. In fact, it will be bad. It will be painful for both partners. Okay. So again, you are nursing students. We're talking about it point blank, black and white. Wala yun ay mga gray diya nga pasumbingay because it is natural. And with the hierarchy of need, sexual pleasure is number one still. Okay, continue with the report.
Okay, so that ends the introduction to the reproductive
And then
system.
ito, please don't forget, when we go into your medical surgical nursing, you will really understand why sex is important because every after chapter of the unit like cardiovascular system, after that, bisan pag nahuman nakag-atake sa kasing-kasing, we will always be discussing about sex. Why? Because your clients will often ask you, gikan siyang giatake sa kasing-kasing. Dayong mangutana man na siya, ma'am, sir, kanang pwede pa ba gihapon kung makig-sex akong partner pagka-discharge na ako? Yes, and it is really very practical because they will not be asking the doctors, they will be asking the nurses. So it will be your job. Okay, so you must know how to advise the clients, your clients or your patients, how to do sex. Yes, you have to advise them what to do in order for them to have a safe sexual life. Again, kamumoy mo advice, Ana. And please take note, there's no room for anybody to be shy about it when talking about such matter with your clients. You have to spell it out. Kung otin-otin, kung bilat-bilat, ana na siya. You have to spit it out. Okay? So walay mga malisya-malisya. The malice only happens sa inyo nga huna-huna. If you're talking about bilatan, otin, and iyot, if you do not put malice to it, it will just be ordinary words. Why is it that when you say sexual intercourse, it will be normal for you? There will be no reaction when you say sexual intercourse. When in fact, binisayo ni mo sexual intercourse, it will be simply iyot. And then, kung musulti kang iyot, mura mo mauknol. Kay lagi, at the back of your mind, iyot is baso, sexual intercourse is not. Kay gi-in-English man. So in English on lang tanan. What if your client does not understand English? Good if English speaking siya. If dili in tawon, magsige mag-in-English dia, di pagyapon siya kasabot. Okay? Just food for thought for you when you'll be working. You have to spit it out. Wala yung mga inarte-arte, ha? Sige, next slide. Next reporter.
Okay, so good morning, everyone. I am audible.
Edible
Yes.
ka edible.
Okay, so now let's proceed on chapter 40 entitled, next slide, please. Drugs affecting the female reproductive system. Okay, so next slide, please. So these are the contents of my report. So first, we have the brief introduction. Second is the drug therapy across the lifespan. Third is the sex hormones and estrogen modulators. And fourth, fertility drugs. And lastly, the uterine motility drugs. Next slide, please. Okay, so these are the terms that you will be encounter as we go on the slide. So we have abortifacients. It is a drug used to stimulate uterine contractions and promote evacuation of the uterus to cause abortion or to empty the uterus after fetal death. Fertility drugs. It is a drug used to stimulate ovulation and pregnancy in women with functioning ovaries who are having trouble conceiving. Oxytoxic, these are the drugs that act like the hypothalamic hormone oxytocin. They stimulate uterine contraction and contraction of the lacteal glands in the breast, promoting milk ejection. Progestin is the endogenous female hormone
Please
progesterone.
do not forget this function, same oxytocin. Sige, next. I think it came out in the exam naman yata. Sige, continue.
Yes, Doc. And its virus derivatives important in maintaining a pregnancy and supporting many secondary sex characteristics.
Okay, next slide.
Next slide, please. Okay, so first, let's start on the
This is the second chapter already, no?
Yes, Doc.
Okay.
Okay, so female reproductive system works in a cyclical fashion. So prior to the introduction being discussed earlier on chapter 39, we know that there are many cycles in the female reproductive system. So just like the ovarian cycle, which occurs in the cortex of the ovary. And also we had a menstrual cycle that happens in the endometrium of the uterus. And the phases of menstrual cycle are under the control of the hormones secreted during the different phases of the ovarian cycle. So basically, female reproductive system doesn't work in a steady state fashion, seen much of the rest of the endocrine system. And also the cycles being involved in the female reproductive system are linked to each other. Okay, so remember that changing or altering the components of the cycle may result a huge effect on the body. Okay, so next, hormones and hormonal-like agents are common drugs that affect the female reproductive system. So looking at the picture, mauna siya ang mga site of action sa mga drugs that we use to affect the female reproductive system. So just take a look at that. Okay, so next slide, please. Okay, so now let's proceed on drug therapy across the lifespan. Okay, so for children, estrogen and progestin receive little testing and should be used only with great caution among growing kids. So nga naman, kay makakos man gud siya og epiphysis. Ang pasabot-an na it is a condition nga maka-affect sa ato ang long bones leading to early arthritis. So dapat receive little testing lang mga children ani. Next is for adolescent girls, if oral contraceptives are recommended, then smallest possible dose must be used and the child should be closely monitored for metabolic and other side effects. Now for the adults, women who take any of these drugs should have medical examination annually. So that includes pap smear. So kung nakainom mo sa ng pap smear, it is to check for the side effects and underlying conditions as well as breast examination. So if may mga potential effects na makitaan, is a must. Okay, so women taking estrogen should be advised not to smoke because of the increased risk of thrombotic events. Next slide, please. Okay, so if males use this drug in a certain cancer, specifically prostate cancer, then the possibility of estrogenic effects should be discussed and appropriate support must be offered. So when these drugs are combined with fertility agents, there's a great deal of psychological support and measurements that women should know in order to manage the adverse effect associated with these drugs. Okay, so when abortifacients are used, patient needs a great deal of psychological support. So if ever, upon taking the drug, na ay mga adverse effects nga mahitabo, as a nurse or as a significant other sa patient, mas maayo if i-jot down or i-note down ang mga signs and symptoms instead of verbalizing it. Kay para maka-administer ta og correct na drug. Okay? So, pregnant and lactating women is not advisable to take drugs since its effect will harm the neonate or the fetus. Next slide, please. Okay, so for older adults, hormone replacement therapy or HRT is no longer used for postmenopausal women. So, by the way, HRT is a therapy that contains female hormones to replace estrogen that our body stops making during menopause. So, it is no longer used man sa mga postmenopausal women because makalibog ang ihang mga benefits and ihang risk. That is why patient needs support and reliable information about the usage of the drug, especially ani ng mga idara. Okay, so if patients are also using alternative therapies, their effects on the hormonal replacement therapy and other possible prescription drugs need to be carefully evaluated. Next slide, please. Okay, so now we're good on the drug therapy across the lifespan. So now let's proceed on sex hormones and estrogen modulator. Okay, so the female sex hormones can be used para i-replace ang mga missing hormones and pwede siya mo act in controlling the mechanism of endocrine system. para ma-decrease ang mga gina-release nga endogenous hormones or what we call mga originating hormones na mismo gina-produce sa ato ang body. Okay, so drugs that act like estrogen, particularly at specific estrogen receptor, are also used to stimulate the effects of estrogen in the body with fewer of the adverse effects. So now let's proceed on the drugs. Under sex hormones, we have estradiol, estrogen conjugated, estrogen esterified, and estropipade. Under progestin, we have desogestrel, drospirenone, etonogestrel, levonorgestrel, medroxyprogesterone, norethindrone acetate, norgestrel, and under estrogen receptor modulator, we have raloxifene and torimifene. Next slide, please.
Okay, now the very common tamoxifen was not mentioned. I don't know why. Mas common man ang tamoxifen. Tamoxifen, raloxifene, torimifene. Now, these are your, actually, you can call it a SERM, S-E-R-M, or your selective estrogen receptor modulator. That is called in short as your SERM. Selective estrogen receptor modulators. This was mentioned by you earlier. Now, this will have the same effect of your estrogen, but less of the side effect. Muna yung mention ganyan. Okay, next slide.
Let's go. Okay, so next slide, please. So under progestin, also we have progesterone and olipresol. So you may scan the usual dosage rather, and indication of this drug on page 1679 to 1680. Okay, so now let's proceed on sex hormones. Okay, so female sex hormones include estrogens and progestin, which is the endogenous female hormone progesterone and its virus derivatives. So first, let's discuss on estrogen. Okay, so for the therapeutic actions and indication, for the mechanism of action, it stimulates ovulation. So on what way man siya nga nung stimulate ovulation? So they will affect the release of pituitary follicle stimulating hormone or FSH and luteinizing hormone or LH. So on the previous chapter, we already know what is FSH and LH. So ang FSH and LH, they controls the menstrual
Okay, next
cycle.
slide.
Okay.
Mana, balik naman.
Yes, doc. Okay, so for the indication, it is a treatment for discomfort of menopause, female hypogonadism, ovarian failure, postpartum breast engorgement, and amenorrhea. So estrogen produce a wide variety of systemic effects, including protecting the heart from atherosclerosis, retaining calcium in the bones, and maintaining the secondary female sex characteristic. Okay, so now let's proceed to the progestins. Okay, so ang progestin is ginagamit ni siya as contraceptives, and mas effective siya if i-combine og estrogen. So mga example ana is mga available contraceptive is like monophasic, biphasic, and triphasic preparation. So basically kaning mga progestin is mostly mga birth controls ni siya ng mga pills. Okay, so for the mechanism of action rather, so it transformed the proliferative endometrium into a secretory endometrium. It inhibits the secretion of FSH, LH, and uterine contractions, preventing follicle maturation and ovulation. So if it is used as contraceptives, the mechanism of action is unknown, but it is thought that circulating progestin and estrogen trick the hypothalamus and pituitary and prevent the release of gonadotropin-releasing hormone, or GnRH, FSH, and LH, thus preventing
I do
follicle...
not know why you said or why the book says it is unknown. It is still your negative feedback mechanism that controls this, because if you have a lot of progestins already, it will send signal to your hypothalamus to decrease the release of your releasing hormone, and so with your pituitary to decrease the release of your FSH and LH. So ano na siya, it is still negative feedback. So the mechanism is really known. It is negative feedback. Okay, next slide.
Okay, thank you so much, Doc. Okay, so for the pharmacokinetics, under estrogen and progestin, so estrogen and progestins are taken orally and will absorb through the gastrointestinal.
Okay, these are your estrogens, your estradiol, your estrion, and estriol. Estron, estriol. Wala lagi kay estriol dere. There are three types of estrogen. Estradiol, estriol, and estron. Ang imo ra estron ra ka og estradiol. Wala kay estriol. I do not know why. But anyway, as long as mao ni sila ang imong mga types of estrogen preparations. Okay, next slide.
Okay, so muna siya mga available listed drugs. Forms the eye niya.
Drugs to siya, gimension ganina ha. Nga akong gimension katong tulo ka
Yes.
book, these are your estrogen preparations. But katong gimension ganiya sa slide, katong gilista ganiya sa sa table, those are the drugs already. These
Yes,
are
Doc.
your progestins, Rapod. Okay. Okay, your norgestrel, your progesterone, etc. These are your progestins. Okay, so do not forget that. Usually, these are used for contraception, like your norgestrel. This is a depot. The one they use, the norgestrel patch. Okay, so yes, there's a patch, by the way, for contraception. Okay, now, na vaginal ring, transdermal. Muna siya patch ni transdermal. I-patch na siya. Muna bitaw plaster lang. Butang ni ba muna siya og salon pass. Nga naa siya dihay imuhang contraception. Na di mo hinahinay na siya absorb. Transdermally. Pwede pa na siya imong i-spray sa imuhang bilat na vaginal cream. Na imong injection, implanted, whatever. Next slide.
Okay, so now let's proceed. Thank you so much, Doc. So now let's proceed on contraindications and cautions. Under estrogen, we have any known allergies to estrogen because para makaprevent ta og hypersensitivity reaction. And also idiopathic vaginal bleeding, breast cancer, any estrogen-dependent cancer with a history of thromboembolic disorder, cerebrovascular accident, and heavy smoker kay para makaprevent ta og risk of thrombus and embolus development. We also have hepatic dysfunction because its effect maka-affect man siya sa atong liver function. And ang pregnancy because it can cause a serious fatal defects, ang metabolic bone disease because we know that one of the action of estrogen is a bone conserving siya. So it is really contraindicated for metabolic bone disease. Renal insufficiency because it may interfere with renal excretion and can increase the risk of potential side effects on fluid and electrolyte balance. And lastly, on hepatic impairment, because it alters metabolism and increase risk for side effects, those on liver and GI tract. Okay, so for now, progestins, under progestins, we have the presence of pelvic inflammatory disease or PID. We also have sexually transmitted diseases, endometriosis, and pelvic surgery because ang iyang effect sa progestin is mo diretso siya sa vasculature of the uterus. And we also have hyperkalemia due to renal disorder, specifically ang drug na drospirenone, liver disease, and adrenal dysfunction. Kay ang drospirenone manggod is naa siya kanang anti-mineralocorticoid effects nga if kana siya igamito na siya nga drug then mas ma-worsen na nun ang condition sa mga above mentioned nga mga condition. Okay, so use with caution in patients with epilepsy, migraine headaches, asthma, cardiac, and renal dysfunction because of the potential exacerbation of this condition.
Now, with regards to the use of progestins in a PID or pelvic inflammatory disease, do you know what is a PID?
Yes, Doc. Yes, Doc.
Unsa man ang PID?
For a while, Doc.
Ay, wala di ay. Sige, Google sa. Okay, so your PID or pelvic inflammatory disease is actually a disease sa imong sulod sa imong pelvis, sa female pelvis. So, unsa man ang pelvis, female pelvis, kato na siyang ga-contain sa inyong, that is the lower portion of your abdomen, the lowermost portion, your pelvic cavity, which contains your internal sexual reproductive organs, internal reproductive organs muna sa imong pelvis. So that's why kung mag-opera gani ang mga doktor para kanang sakit sa mga babae muna sa mga pelvic exploration or pelvic laparotomy muna may na because sa pelvis, yeah. Usually, what you see with pelvic inflammatory disease is mag-fever ang pasyente, mag-lower abdominal pain. Sometimes it would mimic this is one of the most common disease that mimics your acute appendicitis. So, mauna nga pananglitan kung babae gani, yagaduda kang appendicitis, dapat kuhaan mo pregnancy test ang babae o also you ask for the sexual history. Again, it is a must for you to ask for the sexual history. Why? Because pelvic inflammatory disease happens with sexually active females. Okay, you have to ask the sexual history, but with caution. Okay, when you asked about this, dili pud ka mangutana nila because you will be taking your history. sa pasyente, you will not ask the patient like, dahil na iyota na ka, dili man po na ingon ana. So, kung maka-English sa pasyente mo yung ka nga, sexually active ka, miss, na, or do you have a boyfriend that you always go out with, na. So, pasumbingay na siya, yes, but it will help a lot. Dili po ka, kung panalitag bastuson hino ni imong pasyente, well, you can always say it blankly kung bastuson po di mong pasyente, because you can determine man sad. Okay? Now, talk to the patient according to her status. Okay? Be it kanang mental status niya or whatever status. So, hindi mo siya istoryahan og tarong. Now, again, when you ask for the sexual history of the patient, di ay mga babae, do not ask this with the presence of the parents or the presence of anybody else. Ask this privately. Kamurang doon sa kwarto. Reason is, they will never admit that they have had sex. Mind you will never, all you females, kamo, you will never admit that you have had sex already. Mind you, nobody will admit. So, if sexual history inyong istoryahan, do it privately. Kanang kamurang duha sa room. Kanang mag-heart-to-heart talk mo. And please, give an introduction nga miyong ka, ay ragkawari ma'am, ay ragkawari miss, ka anad na ko anak, ako bitaw. Even if you haven't experienced yet, you have to assume. You have to assume that role nga naka-experience ka. Para mo open up po sila. Kaya if magpa-virgin po kag effect, hello, you will not get the right history. Okay? And, very important lesson, do it privately. I have experienced this before. 13 years old, and please do not assume that a 13-year-old cannot have sex. Do not. Okay. Please consider them not virgin anymore. Ha? Sa inyo rin ang una-una. Of course, di po musulti sa bang tao na. I happen to have a patient, 13 years old, from Darwin, okay, sa taga Darwin ninyo din ha, nga kanang came to the hospital at around 1 or 2 in the morning. 1 or 2 in the morning. I was on duty then sa provincial hospital. When I was still connected to the provincial hospital long time ago. So, the 13-year-old female was with a friend, not with the parents. 13 years old na. Pero 13 years old, dalagaw na kayo siya with makeup already. Dalagaw na siya. So, niyato siya sa hospital for abdominal pain. Examination was done. Of course, it point out to appendicitis because of the right lower quadrant pain. Yeah. So, surgery man siya gibutang. So, gitanaw na ako, acute appendicitis man ang diagnosis by history and examination. But I noticed that the patient is kung todo og makeup and traveling alone sa boulevard sa Dumaguete without the parents, 13 years old, at 1 or 2 in the morning. That will give you a question. That would ring a bell. Because of that situation, of course, the father came a few minutes later, niabot ang father, and I asked the father that I am going to get a pregnancy test on the patient. Og nasuko ang father. Puwerte gyud niyang sukuha. Unsa gud ang klase nga pagka-doktor nga nakabata na akong anak 13 anyos inana. Niyong ko nga sir, standard ng buhaton to rule out pregnancy kay wa man gud ta kay balo. If ever mag-opera ko niyang diretso karon, unya masayop ta kay dili di ay appendix ni, kay tungod di ay buros ni, nadako na kay problema. Puwerte niyang yaw-yaw, puwerte niyang sukuha di nahilom sad ko. Di ba doon naman siya katungod masuko sad. Okay? Now, my problem there was that I did not ask the patient privately kung nakaiyot-iyot na ba siya. Wala. Diretso ra kog sulti sa father nga, can we get, it is a standard for us, for all females nga consider taga-appendicitis, to get a pregnancy test just to rule out pregnancy. You know what happened? So, walay pregnancy test gibuhat. I scheduled the patient for surgery. When we opened, ang akong nakita is bleeding inside. And that was a ruptured ectopic pregnancy, 13 years old. See the importance of history and asking properly. Okay. Kato siya, I could have asked the patient diretso. So, sige na kag-iyot-iyot lang ga. Kahit tungod, lagi alauna, alas 2, kadawon 13 anyos, taga-dawin siya, nganong nagisuroy-suroy siya ng boulevard. Kunya ang parents po, dilo useless. Wala siya kabuyag sa iyang anak. Nga sige suroy-suroy, kung todo og makeup. Well, what ay pakialam kung ganegosyo siya or what, ang babae, what ay pakialam kung gipasagdaan sa siyang parents. But ang atong concern is our profession. As nurses, we should ask properly. Okay. So again, pelvic inflammatory disease happens with sexually active females. Ayaw po ninyo kung kanchawira o niya, may mga PID siya. Well, understood na siya, pero ayaw po ginaanala, sige nakagiyot-iyot ta kay PID na ka. No. It is not proper. And who knows, ikaw po di ay. So, ayaw lang na siya gilabti as did that. Okay? So, next slide.
Okay, so next slide, please. Okay, so now let's move on to the adverse effects. So under estrogens, we have under genitourinary or GU tract, it is a breakthrough bleeding, menstrual irregularities, dysmenorrhea, amenorrhea, changes in libido. And under GI tract, we have nausea, vomiting, abdominal cramps, bloating, colitis, acute pancreatitis, cholestatic jaundice, and hepatic adenoma. And under systemic effects, we have
Okay, here, dito na lang. Next slide.
Next slide, please. So under progestin, so systemic effects are same.
Okay, maupo na. Next slide. Balik-balik na siya.
Okay, so now let's proceed on the clinically important drug-drug interaction. So under estrogens, so if estrogens are given to combine with other drugs that enhance the hepatic metabolism, so example lang ng mga barbiturates, sermafine, tetracyclines, and phenytoin, so serum estrogen levels may decrease. And if ever naatay mga drug na ginadugang or ginakuhaan na ga-contain og estrogen, so as a nurse, we should evaluate the drug sa mga possible nga effects and mas maayo if mo consult og professional for appropriate dose adjustment. Okay, so for smoking while taking estrogen should be strongly discouraged because the combination with nicotine increases the risk for development of thrombi and emboli. Grapefruit juice can inhibit the metabolism of estradiols, leading to increased serum levels. St. John's wort can affect the metabolism of estrogens and can make estrogen-containing contraceptive less.
Okay, next slide.
Okay. So now for the prototype summaries, under estrogen we have estradiol, and under progestin we have norethindrone acetate. So
okay, next slide.
So now for the adverse effect on estrogen, so now let's proceed on the estrogen receptor modulator. Okay, so the drugs under estrogen receptor modulator, we have raloxifene and torimifene. So ang mga long-term...
Okay, that is already the mechanism of action. You don't have to worry. That is already the mechanism of action. These are selective estrogen receptor modulators. Okay, so next slide.
Next slide,
This is good for to prevent osteoporosis sa imuhang menopausal nga women.
Yes, Doc. Thank you so much, Doc. So for the pharmacokinetics, it is prescribed orally. It absorbed in the gastrointestinal tract.
Okay, next slide.
Okay, so next slide, please. On clinical important drug-drug interaction, so cholestyramine reduces the absorption of raloxifene. Highly protein-bound drugs such as katong mga mga diazepam, ibuprofen, indomethacin, and naproxen may interfere binding site. Warfarin taken with raloxifene may decrease the...
Okay, next slide.
For the nursing consideration for conceiving sex hormones estrogen receptor modulator, under assessment or history and examination, so first we need to assess for contraindications or caution, and we need to perform a physical assessment to establish a baseline status before beginning therapy and during therapy to determine the effectiveness of therapy and evaluate for any potential adverse effects. We need to assess the abdomen, including auscultation of bowel sounds and palpation of the liver to identify abnormalities. And we need to also measure abdominal girth as indicated to evaluate for blotting. We need to also assess skin color, lesions, and texture, affect orientation, mental status, and reflexes, and blood pressure, pulse, cardiac auscultation, edema, and perfusion, which will reflect circulatory status and show any changes associated with thromboembolism. Next slide, please. And also, we need to complete
Okay,
or assess.
nursing diagnosis na ka.
Yes, Doc. Next slide. Nursing diagnosis. Okay, so nursing diagnosis, it related to drug therapy might include the following. So excess fluid volume related to fluid retention.
Okay, why? Why will there be risk for excess fluid volume? This is salt retaining. Please take note, this is salt retaining yung estrogen. So, mag-retaining yung salt, ma-retaining yung fluid. So, you have increased chances of hypertension here. Please take note, that's why you do not give estrogen. Estrogen, I'm talking about estrogen. Okay, so this will not be recommended above 35 years old, I guess. I'm not so sure about the age. I think will be above 35 degrees recommended. Again, because of the risk of hypertension, secondary to salt retention, and your, by the way, fluid retention. So, increased risk. Plus the fact nga, increase ang imong chances of thromboembolic phenomenon with estrogen, especially if you do smoke. Bisan gandi ka smoke, naku mag-chance of thromboembolism, how much more with smoking? Somewhat na imong chances. Smoking per se will increase your chances of thromboembolism, smoking lang. Estrogen also will increase your chances of thromboembolism. I-combine mo ang duha, hello, the 1 plus 1 equals 2. Okay? So again, going back into your COVID chances of thromboembolic phenomenon with COVID is very much lesser than chances of thromboembolic phenomenon with smoking. So karon, ganahan ka mo smoke o ganahan ka magka-COVID. Next slide.
Next slide, please. So now we have the planning. So just read on that. And then
Implementation, etc. Next slide.
Next slide. For the evaluation. Okay, so now let's proceed on the...
Okay, kani fertility drugs. These drugs are used kung wala pa mo nakaanak or maglison mo panganak. Go.
Okay, so it stimulates the female reproductive system. So the drugs under fertility drugs, we have the cetrorelix, clomiphene, ganirelix, chorionic gonadotropin, folotropin alpha, menotropins, chorionic gonadotropin alpha, folotropin beta, and urofluoritropin. So you may scan the usual dosage and indication of this drug on page 1714. Okay, so now let's proceed on the therapeutic actions and indication. So the mechanism of action is that they stimulate follicles, ovulation, and hypothalamus to increase FSH and LH levels, leading to ovarian follicular development and maturation of ova. So ang kaning
look at this. This is also used for spermatogenesis sa mga men with low sperm count or menotropins. Tanawa. Go, next slide.
Next slide, please.
For men and women, magunik atong ganimong dimension, female naman. For the male also, it's used for sperm maturation. Why? Because there are males who have less sperm count. Okay, now what is the normal sperm count, diay? Normal sperm count is pila? Lubitania. RV Lubitania. What is the normal sperm count? Absent is Lubitania o Chua. Chuchu. Normal sperm count. Absent po ni Chua. Absent? Present. Gakarat-karat din. Sige. Pasabutan na, hinay ko no iyang signal. O ikaw, Dino, what is the normal sperm count?
15 million, Doc.
20 million. The normal sperm count is 20 million. So, kada ejaculate mo, if you have to count the number of sperm, it will be 20 million on the average. That is the normal sperm count. So, if you only have like 10,000 pananglitan, no, that's very low, as in super low. So, if you want to increase your chances of impregnating, you have to increase your sperm count. You can use these drugs. okay, to increase your spermatogenesis. And you can also use ovulation-enhancing drugs to stimulate ovulation, so that there will be higher chances of women to become mature. But the chances are, if you have if you are treating women with fertility enhancing drugs, you will also increase the chances of multiple pregnancy. Why? Because you cannot control the number of ovum that you stimulate. So that is also the risk of your fertility drugs. Mag-multiple pregnancy pero niya ka kay mag-multiple ovulation ka. So now, with multiple ovulation, for this drug, for these patients undergoing, for this female undergoing fertility treatment ng multiple pregnancy, most doctors would eliminate the other embryo. Now that is a problem, because it is actually these fertility experts who are determining which of these embryo should survive. So, by the way, embryo na ha. So it's more likely muhimo gini silang tao. So kung imong tangtangon ng uban, it would be some sort of abortion lang gihapon. So there is an ethical question here. So, because that is a common side effect of fertility enhancement, multiple ovulation and multiple pregnancy, of course, to follow. Okay, sige. Sometimes you can use, with your hormones na, you give hormones sa mga bata kung wala sila hormones. Like, wala pa sila. Niabot na lang 15 anyos, 20 anyos ang babae, wala pa siya ovulate. So, wala pa siya menstruate. Which means, basig hypogonadism siya. So, you can give your kanang hormones. Okay, so, kana. Sige, next slide.
Next slide, please. Okay, so for contraindications and cautions, so it is primary ovarian failure. Okay, since
Okay, next slide. Okay, balik-balik na siya. Kani, ovarian hyperstimulation. Na siya akong gipasabot. So, daghan kay kang manggawas itong ovum. Posible katutanan nga ovum ninyo mabuhi ito. See? And then, you don't want that. What if pulo ka buok na ditong nangabuhi nga ovum? Nga nakamit po og sperm ninyo, pulo ka buok. Hello. So, dapat ipanangtangon tong uban. Who will decide? Now, that's a problem. Because the 10 embryo nga mo develop dito pananglitan, they will not survive, of course. Pulo ka buok, sulod sa tiyan. No. So, dapat panguhaon to uban. Then, who will decide? Muna rin akong question. Anyway, those are ethical questions with regards to fertility problems. Next slide.
Next slide, please. Okay, so for nursing consideration for patient receiving fertility drugs, so basta lang mo anak, guys, mga assessment history.
Good. So, thank you. Next.
Next slide, please.
Mga body image, etc.
Next slide, please. Sige pa.
Okay, so next. Basahan natin na. Please, those are important things for nurses. But then, self-explanatory ramang God. Sige, next.
Okay, so we're down to the last for uterine motility drugs. So uterine motility drugs stimulate uterine contractions to aid in labor or oxytocin or to induce abortion or abortifacients. Tocolytics are drugs that are used to slow down uterine activity. Tocolytics rather, okay. So sorry about that. So these drugs are, kaning tocolytics is, these drugs are designed to inhibit contractions of myometrial smooth muscle cells. So ang mga drugs nga under tocolytics are mga magnesium sulfate, indomethacin, and nifedipine. Okay, so for terbutaline, a selective Terbutaline, a selective beta-2 adrenergic agonist was often used off-label as tocolytic.
Your terbutaline is actually your Bricanyl, which is used for predominantly used for bronchial asthma, your terbutaline. Again, it is
Yes.
used predominantly for bronchial asthma, but it can be given to decrease the chances of abortion or to decrease abortion, to decrease chances of premature labor and abortion. So because it causes relaxation of the uterus. If you can only use your alcohol, no, by drip, alcohol drip, your ethyl alcohol by drip, it is one of the best tocolytics on alcohol, but you can have man good. Kaya lang painom ni mo og sigbido ta imong pasyente para ma-relax. Okay, si hubog na yung bata wa pa na-relax. Sige, that is terbutaline. It is beta-2 selective agonist. We already discussed alpha 1, alpha 2, beta 1, beta 2. And of course, you have noted that there is such a thing as your beta agonist and beta blocker. And this one, this is a beta agonist, terbutaline. Okay. Next.
Okay, so for the okay, so next slide please. Hydroprogesterone copperate was approved to reduce the risk of preterm birth in women with single-tone pregnancy. However, it isn't approved for use in multiple pregnancy kay tungod.
Okay, and these are the example of your oxytocics. These are your methylergonovin, methylergometrin. Wala po kayo methylergometrin diri nga ginagamit. It is marketed as your Methergine. Methylergonovin, methylergometrin. Okay. Oxytocin. There. Dayong unsa man ni si Ruben John Carlo karon pa man ni sulod. Okay, hapit na mo end ang klase. Abortifacients are those that causes abortion. And these are your carboprost, dinoprostone, your mifepristone. There. Okay, and this is your sa may laing ng samanis. These are your prostaglandin E, by the way, ha? Inyong mifepristone, this is prostaglandin. Okay, prostaglandin E causes uterine contraction. That's why it causes abortion. Again, we have a drug that was initially marketed for cytoprotection to prevent ulcer formation sa imuhang stomach. Again, there was a drug that is a very effective cytoprotective agent. It is made up of prostaglandin E, and this is your misoprostol. Okay, your marketed as your Cytotec. Again, this is your misoprostol. This is marketed as your Cytotec. Misoprostol is prostaglandin E. Okay. Now, nagay kay ibutang imong prostin E ito is actually this is prostaglandin. This mifepristone is an analog of your Cytotec. Now, when they gave this misoprostol sa pregnant woman, abortion happened. So that's why they studied more about it, and they noted that prostaglandin E can cause severe uterine or very strong uterine contraction that may cause abortion. That's why nowadays the misoprostol is now marketed for as an abortifacient rather than a cytoprotective agent. You will never be able to buy this in the market because it is not sold in the market anymore. It is sold only through your obstetricians. But since very kuan man kayo ning mga tao, very resourceful, there are black markets, there are black markets nga sell og Cytotec for abortion. And please take note, if you're planning to have abortion, please don't. It is a sin to have an abortion. Not only that, if you don't believe in God, it is a sin to have an abortion. Not only that, kuan siya, if you use your Cytotec for abortion, you might die if you will not be under the supervision of an obstetrician, because sometimes your Cytotec or your misoprostol will cause a severe uterine contraction, which often affects your other muscles, causing convulsion. You might die because of that. So again, it is, so what kung maburos ka, so what kung naa ka na? It doesn't matter nowadays. Okay? So ayaw ipakuha. If ever maburos mo, ibulagan mo sa iyong uyab, ayaw na siyang ipa-abort. Raise the baby. Next slide.
Next slide, please. So now, oxytocin, it stimulates the uterus to contract. It is similar to the action of the hypothalamic hormone oxytocin, which is stored in the posterior lobe of the pituitary gland. So drugs under oxytocin, we have methylargonovine and oxytocin. For therapeutic indication,
Ano
the
naman, balik-balik
mechanism
na
of
stimulate
action.
uterine contractions. Yung next slide.
Slide, please.
Mora gyapon na stimulate uterine contraction for breast milk ejection. Ano, by the way, I have a story to tell. Ano, magudino? Since you know that your functions of your oxytocin is, sa ganito, it causes uterine contraction, it causes milk ejection. So naman ko ito yung story adto. I heard when I was still in my younger days, I heard nga nice na ay kunoy mananabang sa bukid. Mananabang ha, you know what is mananabang? Kanang hilot, kanabitang mo mutabang kung magpanganak ka. Mura siyang midwife, pero Bisaya nga midwife. Dili gid actually midwife. Mura siya mananabang, tawag ana. Now, na ako na mananabang sa bukid nga lalaki. Very famous, nga very good mananabang sa lalaki. But what he does usually is, iyahang iyoton ang mama nga mga lanakay para sayon ang delivery, for ease in delivery. So, do you think there is a rationale, there is a scientific explanation to that? Hindi no, ikaw rin may nakita na kung nadiri mong naong. Do you think there is scientific explanation nga iyahang iyoton ang mga lanakay, ang mama, para sayon mga anak ang mama, daling mga anak? Do you think there is a scientific explanation to that?
Yeah, I think so, Doc.
Ay, you think so? So you will do it, di ay?
Okay, like, naman ko I've heard po before, Doc, na like, if ever mo engage ang kanang dol na mo labor ang mama niya, mo-engage sila sexual intercourse, mas madali ang or mas
Why lagi? Why?
mas muwaidan ang passage sa
Na
baby.
madaan, dako day kay kagutin, muway din ang passage bata. May imong ulo, imong gisulod, di man. Utin raman na. Dili na orgasm po chuwa, no, na. We have just explained that. Para dili kayo lisod ang contraction, dili mo lisod ang contraction, usaran ng klaseng contraction, ana. Why? Please take note, if you have read about your sperm, your semen, the semen contains prostaglandin E. It is very rich in prostaglandin E, ang inyuha nga tulos. And you know the effect of prostaglandin E already. Prostaglandin E causes uterine contraction. And that is primarily the reason. Actually, katong tawhana, wala siya kay balo nga na prostaglandin iya nga tulos. Pero, na-notice ra niya nga kung panalitag, birahan ni mo ng mga lanakay, hapit na mga anak, paspas iyang panganak kung birahan ni mo. And that's precisely the reason why. Wala siya kay balungano. Pero illegal na yan, dito siya pwede madaan. Nga nagong ka ng may buhaton. So, again, prostaglandin E is a good cytoprotective agent. It prevents your gastric ulceration. It tries to heal gastric ulceration also. So, question now is, if you are a straight nga male ka ha, or if you are a female, any sex, by the way, not only males, not only females, but in between, if you are having a gastric ulceration that is intractable. Intractable means it cannot be treated by any other medication. That is intractability. Intractability means it cannot be treated by any other medication. If you have an intractable gastric ulcer, then the only medicine that can heal it is the sperm. Are you willing to drink it? Ikaw, Miss Innocencio.
Yes, sir. Yes, Doc. Probably yes, Doc.
Probably yes, hindi ka sure.
Yes, Doc.
Yes. Of course, it is very practical. I don't think you will say no to it. I am not telling this to you para magbinastos lang. This is practical purpose. Practical for practical reason. Nga naman, Kana ganing taong na ay cancer, they will do anything just to be treated. Kana pa unyang para mohigo para ana, then maayo ka. See? So, I do not tell me nga, buyag, di ko ana. No, may istorya na nimo. In other words, plastic ka nga pagkatao. Because you will do anything just to be treated. Na. Okay? And then, dili man po na binastos tayo mong gibuhat. You do it for health reason. Na. Okay, next slide.
Next slide, please.
Okay,
So,
maghihapon na siya. See, next slide.
okay, so now for the type
Okay,
separate.
oxytocin. Next slide. May balo naman ka sa action, ana. Okay, next naman na. Humana, balik-balik na. Balik-balik. Sige, nagbalik-balik na. Okay.
Okay, so now let's move on to abortifacient. So it is used to evacuate uterine contents through intense uterine contraction. So muna siya mga drugs. We have carboprost, dinoproston, and mifepristone. So for the therapeutic actions and indication, makastimulate siya og uterine activity, dislodging any implanted trophoblast and preventing implantation of any fertilized egg. So kani siya na drugs is gina-approve ni siya gamiton to end the pregnancy kung naa pa siya sa 12 to 20 weeks from the date of the last menstrual period. So indication, it is treatment for pregnancy termination and for a while daw kay Rognay nag-left, hindi na ko makita. And uterine atony. Next slide please. So for pharmacokinetics, so these drugs
Okay, now, one thing, ha, oxytocin will prevent postpartum bleeding. Why? Because when it causes uterine contraction, pag contract sa mong uterine muscles, maipit na mga blood vessels. So it prevents uterine bleeding after delivery. It came out in your exam. Okay, so muna. It prevent niyang postpartum bleeding. Kaya again, maipit ang mga ugat kaya mo contract mo ng muscle. Okay, that's about it. So uterine atony means imong uterus, pag human ni deliver, imong uterus remained relaxed ang uterus. Kung remain relaxed imong uterus, open kay imong blood vessel, gitangtangan, di ba natangtang magunang imong placenta na? So imong blood vessel dito nga putol, open siya kayo. Connected na ang placenta sa imong nga uterus. Karon nagitangtang man placenta, so open imong blood vessel. So kung relax imong uterus, grabe ka open siya. Magsikag dugo, matay ka. By the way, postpartum bleeding is the cause of death of Taj Mahal. Do you know who Taj Mahal is?
Yes, Doc.
Kinsa man na si Taj Mahal.
Why?
Famous ba kay na si Taj Mahal? Si Queen Mumtaz is Taj Mahal. Kanang bitang Taj Mahal good sa India good kanang kuan, actually kanang Taj Mahal nga building sa India, that is a mausoleum. Take note. Yes, it is a mausoleum. It is not. I don't know why they are creating it, but it is a magnificent structure, by the way. I have been there. I was in, because I was trained in India sa akong laparoscopy. I visited Taj Mahal. It's really a very nice edifice. It's made up of marble, everything. And it is decorated with semi-precious stones. Ang iyang mga engraving, daghan lang ipangawat na lang. But anyway, that is a very nice structure. And knowing it is huge, unya sa unang panahon pa, wala pa yung mga machines, so giyon sa kanapaghimo. But anyway, Taj Mahal is the wife of Shah Jahan. She died of postpartum bleeding because of uterine atony. Again, going back into uterine atony, kung naapon tayo oxytocin sa unang panahon, gipa-inject sa iya, dito tumamatay si Taj Mahal. Okay, so that's about it. So ni-relax sa iyang uterus, uterine atony siya after delivery. So munang namatay siya because of bleeding. Okay, so that is with the purpose of your oxytocin and your mga katong oxytocics. Sige, next slide.
Next slide, please. So for the adverse
so
effects,
okay.
So for the type
Okay,
separate,
look at this. If you use, perforated uterus or uterine rupture, why do you think this will happen? with using your oxytocin. If you use your oxytocins to enhance uterine contraction prior to delivery, na may uban i-trigger, na may uban i-oxytocin drip para mo contract ang uterus para ka manganak. Please, with oxytocin drip, dapat imuhang i-control ang imuhang drip ani. Why? Because it might cause rupture of the uterus. And you do not do left and right oxytocin drip ha, para mo-enhance imuhang delivery. Why? Tanawon pa maguna kung makaya ba sa puwerta sa inahan, sa bangag niya, makaya bang ulo sa bata. Because sometimes, the head of the baby will be stuck in between your pelvic outlet. Kana sa bukog ba? Diya siya ma-stuck. Malay na to, dako ulo ang bata. So, ma-stuck siya diya. So, gisige na mo pa-contract imong uterus niya, dili kagawas ang bata, more rupture imong uterus. That's about it. So, that is called uterine rupture or perforated uterus. So, next slide.
Next slide, please. Okay, so for nursing consideration, alay lang kung basa na po, guys.
Sige, bitaw. Next slide.
Slide, please.
Okay, mga diagnosis. Okay, in summary, mauna ni siya tanan. Basahan ng summary, balik-balik. Kaya gina siya, huwag ito lang nahimuan. Okay, you read on the summary. This is very informative ang summary niya. Next slide.
Okay, so that ends my report. Thank you so much for listening, guys.
Okay, that is the end of the chapter, Pod.
Yes, Doc. Dili, Doc,
Okay.
napailaing chapter, Doc.
So, napailaing nga chapter after. This
Yes,
is the second chapter, right?
Yes, Doc.
Okay, then we'll have a third chapter on Monday. By the way, the examination for your unit on reproductive will only have one quiz. Again, reproductive quiz will only be actually it will be a unit test kay usa ka exam ra siya for the 3 chapters, usa ka exam ra. So it will be on Wednesday. So on Monday, we will continue with the last chapter of reproductive. Again, Monday, 6 to 7, we will continue. So, everybody doesn't have classes on Monday, 6 to 7, di ba? Yes, Doc. Okay. Nga namang walay naningog. So, kung wala man may klase Monday, 6 to 7, so we'll have a class for the last chapters of reproductive 6 to 7 Monday. Because wala man may quiz sa Monday. The quiz will be on Wednesday. And the quiz will be for the whole unit sa reproductive. Okay? So, you may go now.
Thank you so much, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Thank you, Doc.
Nga nung
Thank you,
wala
Doc.
ang
Goodbye.
misupustol din sa report, nalibog ko sa inyo ang libro. Huwag ibutang ang misupustol. But anyway, na-mention na nato na. Sige, you may go now.
Thank you again, Doc.
Thank you, Doc.
Okay.